therapy. They didn't know that certain OBGYN issues like preeclampsia or diabetes during pregnancy were risk factors for heart disease. And the OBGYNs didn't know how to best screen for heart disease in their patients because we are the primary care doctors for women. So this curriculum immediately, not 1 year down the road, not 3 years down the road, not 5 years down the road, is going to put together real clinical guidelines for the cardiologists written by the OBGYNs.
Wow.
And by the for the OBGYNs written by cardiology. And Tom and I are so honored to be able to help make this happen and support the mission of the American Heart Association, because women's lives are suffering because people aren't connecting the dots.
Yeah. Well, let me ask you this, because half the population will go through menopause, yet it's still consistently one of the most understudied areas in medicine, right? At the end of last year, the FDA removed the warnings on hormone therapy for menopause. Many women, though, they've been confused for a long time, still are a little bit concerned about whether or not HRT is safe. What should we know about this?
Well, first of all, it was called A Shot Heard Around the World 2002, where flawed methodology and misinterpreted headline by the national media really caused the entire world to pull back on offering women going through menopause hormone therapy, or HRT. Now we know that, according to the Menopause Society, for the vast majority of women, especially those who are at low risk for heart disease, most women who are under the age of 60, within 10 years of going through menopause, that menopause hormone therapy, the benefits outweigh the risks.
Right.
So many people are not current with that. I will tell you that I hear and speak to people every single day who don't know that. I myself take hormone replacement therapy, but it's not DIY and it's not one size fits all. So women need to talk to their doctors, but their doctors need to be current in what we've learned over the last 23 years.
Thank you so much for your work and your voice in particular lately. But let's talk about heart disease, because it is the leading cause of death among women, but you say it presents differently in women. So what can you tell us about that?
So first of all, it is the #1 killer of women in this country and worldwide. A lot of people don't know that. 1 out of 3 women will die of heart disease, and everyone thinks that's someone else, right? So around this table, unfortunately, there will be statistics. 80% of heart disease is preventable with lifestyle modifications. That is the good news. But when you talk about the differences that are gender for heart disease, women face a delay in diagnosis, a delay in aggressive treatment for the same condition, let's say heart attack, compared to men. And because of denial, bias in the system, different diagnostic challenges, it's really killing women. And women's heart disease does tend to, heart attack presents a little differently. They still have the #1 symptom of chest pain, but we are more likely to get fatigue, flu-like symptoms, nausea, vomiting, shortness of breath, and we don't know that, right?
Wow.
So it's really,
You think it's just going to be you feel tightness in your chest?
That is still the most common symptom, but there are other symptoms, and women's heart disease is more likely to be caused by what we call microvascular disease, so tiny little blood vessels affected rather than that big so-called widowmaker.
Well, Dr. Jane, you're also a
I'm sorry, I just wanted to ask a question. Jen, how do we get general physicians to recognize that they need to pay attention to women's health issues? What can we do?
Well, first of all, it starts with education and awareness, Whoopi, that's for sure. I tell people, whether they're patients, friends, or on-the-air viewers, if you think you are having a heart attack, time is ticking. You get yourself to an emergency room, and the second you speak to a person at that ER, you say, I think I'm having a heart attack. Using those words is very important, because whether it's a male doctor or a female doctor, unfortunately, there can be a delay, and that can cost lives. So I think that's the first step. And then initiatives like this, and hopefully the gift that Tom and I are so happy that we were able to give to support this kind of combined curriculum. We have a lot of work to do, and it has to start with those baby steps.
Well, Dr. Jane, you're the founder of Agenda, which is a free women's health digital platform, and you cover a variety of topics every week. You're board certified in obesity medicine, and there's so much misinformation out there. So about GLP-1 medication specifically, what what's most important for us to know?
Well, so first of all, I hope all of your viewers just heard my newsletter every week is free, which is very important. You can find it on my Instagram. But yeah, as an obesity medicine physician, I will tell you that I fight misconceptions and myths about GLP-1s every single day. There's a massive social stigma against people living with overweight and obesity that they were damned if they do, damned if they don't. When they were overweight or dealing with obesity, people looked at them askew. When they tried to do something for their health, like take a GLP-1, people look at them askew. That obviously has to stop. But look, in my medical opinion, these are among the best drugs in the world. The first one was FDA approved in 2005.
Wow.
We have a lot of data on them, and they can have side effects. So it's not a DIY type of situation. You need to be followed by a board certified physician who has experience managing patients on these medications. And we're learning more and more about their use in prevention, in maintenance, what happens when you reach your ideal weight, the cognitive protection, the cardiac protection, the kidney protection. The list goes on and on, but that doesn't mean that they're for everybody. So like everything is a more nuanced discussion, and we talk about it every week in Agenda.
That's right. And that's why we love talking to you, because we know we can, when you're talking, we are listening. People believe and understand you know what you're talking about, and that is heaven. Great to see you. I had a whole thing, and so if you want to know more about, I misplaced it. Can anybody read what's there?
Yeah, for more information on her free weekly newsletter, Agenda, go to our website. And you can say the famous lines if you want, Whoop. We're going to be right back.
We'll be right back.